Hi, this is Tim Bonak from Manual Edge Physiotherapy. I'm a physical therapist and a Canadian trained osteopath, and I wanted to talk to you about headaches and migraine headaches, as well as tips to try to figure out if your headaches are actually coming from your head. What we've looked at previously on these videos is essentially neck issues causing headaches, and that can be very frequent and very problematic. In this video, I want to focus on the head and problems with the head that can actually cause headaches. So the only way to look at this is to really look at your history. So I just want you to sit back and relax. I just want you to think a bit. And I want you to go over your life. And I want you to think about blows you've had to your head. We've all had them. Okay, I've had multiple in my life. Some were small, some were big, some were a problem, some were not. So think about, have you had any motor vehicle accidents where you struck your head? Have you had any sports injuries where you've suffered a blow to your head? Even if you had a helmet on or not, it's still a blow to the head. Did you have any falls where you struck your head? Did you collide heads with somebody else? Have you had any kinds of physical assaults in terms of being struck by another person? We do see that, unfortunately, and it can be a real big issue for many of our patients. I also want you to think about the dentist. Dentists are great. I have no problem with dentists. I like them a lot. Dental work can be problematic sometimes. Normal fillings, typically not an issue. The problem comes in with perhaps orthodontia that's been going on for a period of time to rearrange the mobility of the structures in the teeth, which can have an impact on the facial bones. Also, some dentists unfortunately use some considerable pressure, as well as not just with the hand doing the dental work, but a hand stabilizing the head as they're doing work with the tooth. So that can be an issue. So really, history is important in terms of looking at, have you had mechanical strain and trauma to your head that might be an issue in terms of the mobility of all of these different structures. So we have the head here, and all the different colors are different bones, and unfortunately those bones can be shifted around. The mobility involved is not big, but they are like any other joint in the body. So what we can do to evaluate is we can use pressure on different structures to see if they're tender. You're going to use the pads of your fingers and you're going to push on different structures of the head to see if they're tender. We focus on 4 structures. Number 1, the frontal bones about the eyes, above, and on the sides of the eyes. So you would just push above the eyes, even into the socket a bit, as well as on the sides of the eyes and even under the eyes. The second place we're going to put pressure on is the temple area. And the temple area is really important because you've got all these different colored bones coming together, and that can be a real problem in terms of how those structures work and move. So we're going to press with our flat part of our fingers on the area of our temple. Don't worry, we were always told as a child, don't push hard on the temple because it's the thinnest portion of the skull. No worries. So what you can do is you can just use your fingers and you can push in different areas of the temple, kind of behind the eye, and see if it's tender. The third place we're going to look is the back of the head. So here we've got the skull. Okay, we've got the base of the skull here. The neck would go down from here, and we're going to push on the back of the skull above the neck. I don't want you down on the neck. I want you more on the bone. Okay, so you're going to push on the bone, and you're going to see if it's tender to touch. And the last area you're going to look at is the jaw. So this is the jaw joint here, and you can notice it's right in front of the ear. So this hole here is actually the ear. So what we can do to identify that on ourselves is we can look at the flare of the ear here, okay? And you're going to place your finger right in front of the flare. You can actually open your mouth, okay, and you can feel bone moving under your finger. And you can push around that area to see if it's tender, and that can be indicative of jaw trauma or a temporomandibular condition, which is a jaw joint condition. So contrary to popular belief, bone should not hurt when you push on it. Okay, I can push on my elbow, doesn't hurt. I can push on my forearm on the bone, it doesn't hurt. I can push on the top of my head, it doesn't hurt. Bone shouldn't hurt. When it hurts, there's a problem. So you're going to look at all of these areas and you're going to see if there's a problem with how these structures feel with respect to tenderness, which can be indicative of a cranial problem, which again is how these structures move. So again, these structures in terms of the individual bones, and there are many, they have to move on each other. And when you have blows to the head, you impart strain into those structures and you jam these joints. So the joints are actually called sutures between the different bones. So you're going to look at how those structures feel in terms of pressing in different areas. So in terms of headaches, they're coming from actual causes in the head itself. You're going to look at your history in terms of different blows. You're going to push on these 4 areas for tenderness. And if you have tenderness in these structures, you know that there's perhaps a cranial problem, and you're going to have to get that further evaluated by a physical therapist that does very, very specific cranial technique. Thanks.